from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about sleep studies and sleep disorders. Our guest today is Dr. Rabi Lutfi, a pulmonologist, critical care, and sleep medicine physician here at Sarasota Memorial. Thank you so much for joining us today.
Hey, Allison. Thank you so much for having me.
We all know sleep is important, and we all need more of it, I believe. But what actually happens to the body when we don't get quality sleep?
Yeah, so that's a good starting point. Sleep is so important for the body. I think a lot of us just think that, sleep is just when your body rests or you shut off for the night. But in fact, there's a lot of things that happen during sleep. So during sleep, your brain consolidates the memories, the images that you acquired throughout the day. Your immune system also recharges. Your heart, your cardiovascular system resets from all the stuff that happened during the day. So there's a lot of physiological stuff happening at night. And when you deprive your body from sleep or you're not getting good sleep, then you're gonna have a lot of problems. Your immune system, takes a hit, so you become more prone for infections. Your cardiovascular system also suffers from all of that. So there's a lot of complications that can happen during sleep when you don't get the rest that your body needs.
So let's dig into that a little bit. How does poor sleep impact heart health, brain function, mood, overall longevity, if you will? Does it contribute to very serious conditions?
Yeah, so let's break it apart. So if you talk about the cardiovascular system, there are some studies that show that, chronic sleep deprivation, so if you have, bad sleep over a prolonged period of time, that has been shown to increase the risk of hypertension. If you have sleep apnea, for example, that shows that has increased the risk for heart disease, heart attack, stroke. In terms of brain function, I think you mentioned that also, becomes impacted. There's a lot of studies that show that your ability to, synthesize, thoughts, memory becomes impaired, your ability to focus the next day becomes impaired. So there's a lot of stuff that happens if you're not getting sleep. Mood, for example, I think there's increased risk of anxiety, depression that happens as well. So sleep almost affects every single, system in the body.
So does it contribute to those more serious conditions or exacerbate if you have other comorbidities?
Yes, so for sure. So sleep has been shown to increase the risk of heart disease, stroke, and even ultimately death. There's an increased risk of diabetes as well, insulin resistance. So there's a lot of stuff that can happen, particularly if you have sleep apnea that's untreated over a period of time.
How common are sleep disorders and why do so many cases go undiagnosed?
Yeah, they're incredibly common. Actually, they're way more common than what we think. Insomnia, for example, it's been shown to affect about a third of the population. So think about it, a third of the people will have insomnia at some point in their lives. Sleep apnea is also very common. It's something that we see as well on a regular basis. It affects about 15 to 30% of males and maybe 5 to 15% of females. So very, very common. Why is it underdiagnosed? A lot of it is because of the normalization of sleep. I think we all think that, if we're snoring, that's maybe because we're tired or we're getting older, we're under stress, we're working hard. So a lot of it is that, and we tend to normalize our symptoms when indeed they're actually markers of, a big underlying issue. Another thing I think why they're underdiagnosed is lack of access, right? Mm-hmm. So there's not a lot of sleep centers around, there's not a lot of sleep physicians around. So there's not access to medical care in terms of sleep studies. Also, patients don't like to do a sleep study. A lot of them think, I don't want to go sleep, outside of my home in a weird place. So that also is an impediment to being diagnosed. And that's probably why they're underdiagnosed grossly.
And we're going to talk a little bit
Yes.
more about sleep studies in a bit, but who is most at risk for sleep disorders? Are there certain age groups or health conditions which should raise concern?
Yeah, there's a lot of risk factors. Age, for example, is one. The older you get, obviously, the higher the risk of sleep disorders. Males, for example, are more prone for sleep apnea than females. So obviously, sex in that case. Also, if you have diabetes, if you have heart conditions, that makes you more prone. If you're on certain medications, that can certainly make you more prone to sleep apnea, some other sleep disorders as well. So there's a lot of risk factors, but I can tell you for sure that I've seen sleep disorders in every single patient. Like I have athletes, for example, that have sleep apnea. They're as thin as can be. They're very fit, and yet they can have sleep apnea. So it can happen to everyone. We need to keep that in mind. But certainly, some risk factors, will increase the prevalence of sleep apnea.
So you sort of already mentioned the answer to this, but how are sleep issues officially diagnosed?
Yeah, so I mean, it starts in the office. We typically see the patient, get a detailed history, exam, look at the medications that the patient is on, and then after that, detailed history and physical, then we determine what is needed, whether it's an in-home sleep study or whether it's a study in the lab, and then afterwards, we come up with a diagnosis and the treatment management plan.
Why is it so important for people to get that diagnosis and not ignore the signs?
Yes, so I mean, it's important because sleep is not just about getting rest at night, although that is an important aspect, but also because a lot of the sleep disorders, particularly sleep apnea, like we talked about, have increased the risk of hypertension, heart attack, stroke, ultimately death. So we need to treat those sleep disorders to prevent those complications from happening down the road. Also, if you're not getting sleep, you're at high risk of having a car accident, for example. Your ability to focus the next day, to concentrate. So there's a lot of stuff associated. It's to get you better sleep, but it's also to prevent those cardiovascular complications from happening down the road.
So let's talk about those sleep studies. How do they work and what exactly is being measured?
So the gold standard is an in-lab study. It's a study in the lab, in our sleep lab. And what is measured, basically we have multiple sensors that attach to the body, but we look at the brain waves. That tells me what stage of sleep you're in. Are you going into REM sleep, deep sleep, superficial sleep? So we'll look at the brain waves. We also have a heart rhythm monitor to see if you're in atrial fibrillation, sinus rhythm, etc. We have an oxygen sensor that checks the oxygen level throughout the night. We have we look at the chest movement, breathing effort, airflow. So we look at a variety of stuff, and then we put it all together and come up with a diagnosis.
How do you talk to patients about their fears surrounding that sleep study, that it's going to be uncomfortable, they're not going to be able to sleep outside? How do you talk them through that?
Yeah, I mean, that's a big issue because a lot of patients, come in and they're like, I don't want to do a sleep study. And that's the first thing that comes up. What I do is, the nice thing about, where our setting is that our sleep lab is right next to my office, right? So a lot of the times I explain the sleep study to them, and then I actually walk them to the sleep lab, show them the room that they're going to be in, and show them, how comfortable it is. I mean, we have a very nice setting where the room looks like an hotel room. I sometimes have them talk to one of the technicians that's there during the day. They explain the stuff to them. So I try to make it as simple as we can. I show them what to expect. And that makes the patients, much more easy about coming to the sleep lab. And a lot of the times after they do it, they'll tell me, oh my God, this was so much easier than what I thought it would be.
What does treatment look like for patients? And would you say there's more options available now than there used to be?
Yeah, I mean, there's definitely a lot more. For sleep apnea in particular, CPAP is the gold standard and remains the gold standard. But it has evolved over the years. Like the machines that we prescribe now are way more advanced than what they were. They're smaller, they're quieter, they're softer. They have a lot of smart monitoring. You have an app now that you can put on your phone. It tells you how many hours you're using it, whether you're still stopping breathing or not, whether the mask is a good fit or not. So it's just much easier than what it was. But there's also other options. Not everybody can tolerate the CPAP, and there's other options. There's an oral appliance, so I work with a sleep dentist that does those. It's basically something you put in your mouth that pushes the lower jaw a little bit forward and helps at night. There's the Inspire device. I think you talked to Dr. Voster on one of those episodes about it, so I work very closely with him as well regarding that. There's weight loss medications that we prescribe. Those have been FDA approved for sleep apnea. So there's a lot of stuff. And there's some new studies, actually. There's a phase 3 study about a new medication that looks promising for sleep apnea. So I think more and more we're having a lot of options in our arsenal to use for sleep apnea. For insomnia, which is the other, common thing that we see, there's cognitive behavioral therapy is always first line. We try to work with them on better sleep habits. And there's obviously pharmacotherapy if we come to it.
Are there lifestyle changes you first recommend to help improve sleep? that people can do even if they haven't had their sleep study yet or seen a doctor?
Yeah, I mean, there's a lot of stuff, right? So obviously weight loss, regular exercise make a big difference, but also better sleep hygiene. So, going to bed at a regular schedule, not doing anything in bed but sleeping in your bedroom, but sleeping, minimizing screen time, regular exercise, for example, not right before you go to bed, but maybe a little bit before helps a lot. Avoiding alcohol. So there's a lot of stuff that you can do in order to improve your sleep quality. And then we tend to go over patients. We tend to go over all those improvements that can make a big difference in your sleep.
SMH recently opened a new sleep disorder center where you're medical director. So can you tell us a bit about that center and what's so exciting about it?
Yeah, so SMH basically acquired the sleep lab in December, and they've made vast improvements to it. The sleep lab is right next to our office, which is very nice because, like I said, I sometimes take patients over there and show them the sleep lab. But it's a 4-bedroom sleep lab, brand new, newly renovated, new furniture, new everything, state-of-the-art equipment. We have new computers, new monitoring, and there's a technician room next to it as well, where the technicians monitor the patients throughout the night. It's designed to look like an hotel, experience, like a really nice hotel experience. So patients feel very comfortable in it. There's a bathroom obviously available. There's a TV if they want to watch TV before they go to bed. So it's actually very exciting. All the patients that have been there have had very nice things to say about it.
How does having a comprehensive sleep center locally improve access to care for patients in this region?
Yeah, I mean, it makes it easier for patients to come to us and get diagnosed, right? So when you have our office right next to the sleep lab, it makes it so much easier. And then with SMH acquiring the sleep lab, they increased the personnel, the staffing. So now we're doing 4 nights a week. So that has improved wait times and ultimately, patient access to it. And that's going to improve outcome, of course, when patients can come, get in quickly, get their sleep study, get diagnosed, and start the treatment.
What would you say to someone who suspects they have sleep apnea or another sleep disorder, or their loved one is telling them they have sleep apnea or another sleep disorder, but they haven't taken the next steps to getting a referral or getting diagnosed?
I would say don't wait, right? So listen to your body. I mean, if you're snoring, if you're stopping breathing at night, although usually that's your partner telling you that, don't wait. Sleep apnea can have a lot of serious implications if you're not sleeping well. Listen to your body and then either talk to your primary care provider or get an appointment with us. Sleep disorders can cause a lot of problems. They need to be diagnosed appropriately and obviously treated.
So what are the steps? Do they have to have a referral from primary care, or can they just contact a local sleep center like yours and get an appointment?
So in most cases, it's usually a referral. So patients will talk to their primary care physician or their cardiologist, and then they will refer them to us. We will see them in the office and then order the needed sleep study. We do see sometimes self-referrals, but those are few. I would say most of the patients usually come in referred from their primary care provider.
You mentioned earlier the option for at-home sleep studies. How does that work? Do you ever have patients do those? And what's your thoughts on those?
Yeah, so I mean, we offer both. We have an in-lab sleep study, which is the 4-bedroom sleep study, but we have multiple also home sleep study devices that we use. And those are geared for patients who have a high suspicion for sleep apnea, but are also, straightforward. They don't have any significant heart or lung disease that would complicate the matters. And we have a couple types of home sleep study devices. We have one where the patient would come in, pick up the device, and then go home with it, hook it up at night, record through the night, and then bring it back the next day. We have one also that I like to use. It's a disposable device. We order it, gets shipped by mail to the patient. The patient, hooks it up. It looks like a smartwatch. And then it downloads data through an app on the phone. And then the next day, the patient disposes of it. So it's completely disposable, which is nice. And then we just review the data and follow up with the patient.
What is the biggest myth about sleep disorders or sleep studies even that you'd like to clear up today?
Yeah, thank you. I think that's a big one. That's that they're uncomfortable. I mean, the biggest myth, I think, is that patients think that it's uncomfortable, when in fact, it's actually not that bad. I mean, most patients that come in, they actually have a pleasant experience. It does look like an hotel. It's a very nice room. It's very clean. The mattresses are really nice. So most people would come in, they sleep well through the night. They wake up the next day and go home. And, it's definitely not as bad as they thought it would be.
Is there anything else you want to add today?
I think I just want to add one more thing is that, I want to say again how important sleep is. It's a foundational vital sign, I would say. It's one of the most important things that you can do to improve your health. Sleep can affect the cardiovascular system, the brain function, the mood, as we mentioned before. So we need to take care of the sleep, and that may start, with listening to your body, seeing your primary care provider, and getting your sleep disorder diagnosed if you need to.
Dr. Lutfi, thank you so much for being here and answering all these questions.
So thank you so much for having me.
And if you liked this episode of HealthCasts, please like and comment, and visit smh.com/podcast to listen to more experts talking about the health issues which matter to you. Thank you so much and have a great day.